angle screw channels, number 6, number 8, number 11, and number 14, and number 21 and 23 as well, which means that we can bring it in the facial lingually and then make the best contours ever, which is we finalize it just like really top of the line cases. This is the beginning start with the denture setting with the 7 implant, and this, so we see the angular screw channels, especially that area. So we bring it back. How many degrees?
That one was like 25.
25 degrees. So
we did another one on here. It would have been out the inside hole. So we had to bring that one back.
20 degree back.
And then here's another one we slightly did.
Slide there.
And here's one slightly as well. So we did 4 on the upper.
4 on the upper.
Yeah.
Alright.
In our final frame.
So after we check the cut it back facially, about 5/10 millimeter, but we not cut it back the incisor edge, because incisor edge is most likely is a fracture, so we make it really thick that area. That's another key. Now we're talking about the lower.
We did angle screw channel as well.
Number 21 and 23.
21 would have been
So we bring it back. Okay.
back.
We've been using Prit.
Yeah. You can see both of them. An occlusion now.
Underneath panic. Yep. I'm trying to cut it back and nicely done.
Kind of a long span, but what can we do with this space?
That's why
this one we actually cut back twice. We cut it back once for this one, and then we did another cut back for the gum tissue. So it was like a double reduce we did with this one. You can see that extra line just for down there.
posteriors we made the mono. Alright, just from the start to cut it back, and then implant with the angle screw channels. Facially 6-3 level we make slightly out compared to tooth is really sticking out those areas. Alright, that one is the yep. This is what exactly you can see.
So it would have been coming out this way.
Right. I'll bring that one, it's really cool. Alright, so ready? Okay. 2, 4. Nice. Depends on Kelly. Decided. 3 set. All in one. Put it in the manifold. Alright. Start. Going up. And then the other one. 2. Close. Alright. Nice. Awesome. So that area is a more darker color, and then the rest to make more brighter color, but not to make it bad. this is the monolithic, just paste with a thin coat all over the place, and then I make a little bit chroma. Whatever you have, you have the shade tab. This is a BL3, is not still bleaching color, you see, and then you all the way put over incisally. Okay, like this. So think about it compared to the Jason T's. Now is the makeup time, right? Okay, so now apply this dark blue. See? That one looks good. Right? Alright. Then you can do with the white stain if you want to. Just like that. Horizontally. So that was a simple technique. We can finish it with lifelike restorations. Right? It's the same as the other one too, but a little different. That was really challenge to cement because angle screw channel with a little bit about diversity of our implant, which is 7. So before we send it out to the final, the doctor just make sure the all the way fit correctly. There's no rock. And then that one is this is maxillary. We finished that one. This is a mandible. It's a little bit better passer fit compared to the upper. Still, we have to make sure they're all the way down. Okay, that's good. But this is the lower. Alright, this is the final 13 implant actually, with the included angle screw channels. Number 6, number 8, number 11, and number 14, and number 21 and 23 as well, which means that we can bring it in the facial lingually and then make the best contours ever, which is we finalize it just like really top of the line cases. Just finish them up from the impression. It's a long journey, guys, and then we made a verification jig, and after that we had a couple times the wax trying back and forth, as you can see the photo. Okay, and after we finalize it, and then we made the couple of the PMMA, which is temporary. We're trying to bring in as nice as possible, so we make this great contours and shape, especially the aesthetics for anterior reasons. This is more lifelike restorations, right? See the side, see the individual. Sorry, okay, now it's better. Alright, so this one is good, aesthetics. See the more depths and tooth contour, illusion of the tooth, and with the translucency, there is 7 implants involved, and the lower, same things. They're really good. here. So basically, we just cut it back very, very little, the facial area, and then we increased it with a minimum layering porcelain, and then we finalize it just like lifelike restorations, from the tissue. Okay, thanks for watching my video.